Hello everyone, and welcome to Silver Cross Video Magazine. Today we're on the move again, and this time we're on the west side of our campus in the beautiful new Pavilion D, which houses our new urgent care center, our occupational health program, and our Silver Cross Medical Group physician offices. As you can imagine, this is a very, very busy place. Today I'm joined by Dr. Tiffany Groen, family medicine physician who sees patients in Suite 120 of Pavilion D. And Dr. Groen and I are going to be talking about a subject that's on every parent, every guardian, and every caregiver's mind these days, and that is back to school. There's been nonstop coverage in the media about this topic, and we know that there are a lot of questions out there and not that many answers. But before we dive into this very important topic, let's spend a couple minutes getting to know Dr. Groen. So tell us a little bit about you and when you came to Silver Cross.
Yeah, thanks for having me today.
Yeah.
I'm a family and preventive medicine physician. I've been in practice for about 7.5 years, only shortly with Silver Cross Medical Group, about 4.5 months now.
Yes.
Things are going well and we're picking up here in our new office, so we're loving it here. My areas of interest are in lifestyle medicine and preventive care. I do definitely practice conventional medicine. However, I really like to give my patients the opportunity to improve on their lifestyle, specifically focusing on dietary change, exercise, and mental health and wellness before we jump to prescribing medications. Right. More of a holistic approach.
Absolutely. Well, that's so refreshing to hear and so needed because people don't know where to turn for those kind of answers. So, some people don't have a primary care physician. So why is it important to have one?
Primary care physicians, we're your medical home. So primary care, a lot of people think they can just go to all their specialists, but really we're here to help coordinate. And even more importantly, we're here to help keep you well. You can come to primary care for your screenings, immunizations, and checkups, also when you're sick. And we help to manage chronic conditions, so diabetes, high blood pressure, among many others.
Yeah. So it's great to have a resource, somebody who knows you
absolutely
really, really well. Do you treat people of all ages, like even children, or?
Definitely. My youngest patients are newborns, so straight from the hospital. And the oldest patient I ever treated was 103.
103.
Yes. Unfortunately, she did pass away, but I do all ages.
Okay, good to know. So speaking of children, it's a topic that we're all quite worried about and is getting a lot of attention. And all the different school districts out here and in the city are taking different approaches to going back to school. But what kind of questions are you getting from parents and caregivers about their concerns?
Probably the most common questions that parents come to are about the COVID virus precautions. So they're wanting to know if I think what the schools are doing is adequate. They want to know about mask wearing, and they want to know if I'm sending my kids back to school. Luckily, my children are little, 1 and 3, so it's not so much an issue for me.
Right.
But really, any question that's in the media, that's the questions that parents are turning to us with.
Yeah. So what advice do you have for people?
So the advice that I give is really to follow the guidelines. We don't have a lot of strong evidence, so people are just turning to media, and there's so many untruths out there. There's so many myths, and it can be really difficult for people to navigate. So I give them the advice to make sure that they're turning to legitimate sources. The Cdc Guidelines are a really great one.
And I think I read somewhere that the CDC has some guidelines about schools. Is that true?
That's correct. Yeah, there's actually a decision matrix that they have that's out to help. But they not only have that, they have very specific guidelines. Another great source is also the American Academy of Pediatrics. And both of them are strongly supportive for children to return to in-person learning.
Okay.
Whenever possible, but you also have to take into consideration the local COVID virus infection rates. Yeah. It's different in every community, and the underlying health issues of the children, but also their family members and caregivers.
Sure.
We've already seen the harmful effects of children being taken out of their structured learning environment since March. It's having some detrimental effects on social, emotional health and well-being as well. And we know that there's so many kids that need resources that aren't available when they're in their home environments. And e-learning can be really difficult for kids with disabilities too.
Sure.
So schools provide critical services to help our families keep their kids safe and fed and active. That again is not going to be easily done when the parents and caregivers take on that responsibility.
Yeah.
So even though the guidelines clearly point towards in-person learning, it's not always straightforward. You really do have to consider what's best for your family.
These are hard choices, hard decisions, and there is a lot at stake. It's not easy.
Right.
Not for anybody. How about kids going back to college? What are your thoughts about that?
So college is a little bit more straightforward, but also not in different ways. So college kids are, of course, young adults. So although they have a higher risk than younger kids, they are lower risk than your average person walking around the street. The tough part is that so many of them kind of have a carefree attitude, and they may not want to pay full attention to all the precautions like wearing their masks and such. But they're the ones that are actually more likely to spread the virus to the more vulnerable. So I just encourage them to keep in mind that what we are doing to help reduce the spread of COVID is more for the general good of the public than necessarily them individually.
Okay, but it's wearing masks, washing hands,
Absolutely.
6 feet,
Yes.
6 feet apart, and just being mindful of those things for everybody's health. Well, thank you for helping us understand that. Lastly, what advice do you have overall for people on how to stay healthy during this pandemic?
So I highly recommend focusing on general self-care, heightening your immunity as much as you can. Be sure you're getting enough sleep, making sure you're eating a well-balanced diet with plenty of fruits and vegetables, staying active, and then, of course, following your local guidelines as far as social distancing and mask wearing and practicing good hand hygiene.
Yeah, the basics very much.
The basics,
so.
That's unfortunately all we have since there aren't strong even treatment recommendations right now, given it's constantly changing environment.
It is constantly changing. Well, I'm so glad you've joined Silver Cross. We feel very, very fortunate to have you as part of the family, and certainly the advice that you give our patients and today is extremely helpful.
Yeah,
so
thanks again.
Welcome
I'm happy
aboard.
to be here, and if you need a physician, we're here for you.